I'll demonstrate now nutation manipulation of the sacroiliac joint. Nutation refers to an anterior movement of the base of the sacrum in relationship to the innominate. In other words, it's also referred to as a posterior rotation of the innominate on the sacrum. So to achieve the posterior rotation of the innominate on the sacrum or the nutation, we'll have to do a technique in which we flex the leg to induce that posterior rotation of the innominate. So for this reason, we'll flex the leg to achieve that posterior rotation. So again, in this position, we'll want to induce a side bending of the trunk. So I'll side bend the trunk to the left. So I'm going to position the hinge of the table at about a level of L2 between T8 and S1. I'm going to raise up the table to induce a left side bending. And then I'll ask the patient to position the left arm behind the back. Right there. This is performed to try to lock the lumbar spine. In this position, she is side bent to the left and she is rotated to the right. In a flex position is a more predominantly locked position for the lumbar spine. We want to try to protect as much as we can the lumbar spine. Then in this position, we are going to manipulate, as for the counternutation, the sacroiliac joint on the sky side. So in this case, the left sacroiliac joint. I'm going to pre-position the left hip in a flex position. And in this case, again, I'm going to go toward the end range of the hip flexion with posterior rotation of the innominate. Then the leg that's on the mat side is going to be brought into extension until we feel resistance. And I'm going to block this leg with my knee. If you have some difficulties to block the leg, if you have a bigger patient, you can also use a belt to lock this thigh here. It's important you lock it because otherwise the whole pelvis is going to move in a flex position. The next step is being sure that your sacrum is vertical. So you're going to bring that sacrum in a vertical position to be sure you keep that side bending. And then you're going to bring the patient into maximum hip flexion. Your hand being on the ASIS, pushing posteriorly on the ASIS with my left hand. And the right hand can come with the left hand and push here on the posterior aspect of the innominate. So in this position, sacrum vertical, I'll take all the slack. I ask the patient take a deep breath. Then she breathe it out, take all the slack, and then little manipulation. Quick thrust, not much force, quick thrust, and then you slightly, gently release this position. Bring the patient back in the neutral position.